Hello and welcome to Albinism Life with me, Christina Venning-Rose. I am talking to Jay Self. Jay is a children's eye doctor. He's a clinician scientist. He's a professor and he does lots of research into albinism and nystagmus. And that's the subject for the podcast that we're going to be talking about today. In this episode, we're going to cover many topics relating specifically to people who have albinism and also nystagmus. Not everybody with albinism has nystagmus, but a very large percentage of people do. We're going to go through what nystagmus is, what impact it has on vision, what can make nystagmus better, what can make nystagmus worse, and any potential treatment options that there are out there. I hope you enjoy this episode and join me at the end.
Nystagmus is a description of an eye movement problem. There's lots of different types that look similar, but nystagmus is a problem where the eyes drift off target. So if you try and look straight forwards, they will drift, and then your correct reflexes will flick the eye back. So they drift off, that's the problem, and then they flick back. Or instead of flicking back, they slowly drift back. Doctors describe two different types based on which corrective movement you have. So it's either jerk nystagmus, if it drifts off and jerks back, and that's more common, or it drifts off and slowly drifts back, and that's called pendular nystagmus. So they're two different descriptions. Nystagmus is a different eye movement problem to lots of others, where the eyes might flick in lots of different directions, or they might very slowly wander off and just stay there, or the eyes are just looking in different directions. Those are all different things.
How common is nystagmus in albinism?
So we used to think it was essentially everyone with albinism had nystagmus. If you rewind maybe 30 years, people used to write papers if they had a patient that they thought had albinism but didn't have nystagmus. They thought it was that interesting. Actually, we see it a lot. I would say the majority of people with albinism have nystagmus, but there's plenty who don't. And there's also then some who have such tiny nystagmus that it's really difficult to see, and we sometimes have to use an eye tracker if we want to find it. And actually, I've recently had quite a few patients, which I don't think people have reported to me before, who we really don't think have nystagmus, but at certain times their parents have noticed it. So when they're ill or super tired, they have to be in that scenario to even notice it.
Do you know why people with albinism have nystagmus?
So that's a big question. There's lots of theories, lots of people doing work on it, but the fundamental punchline there is no. There's lots of parts of the visual system, so the eye, the nerves, the crossing the nerves, the brain, which might make somebody have nystagmus. Then there's other conditions where you get nystagmus where we get clues because we know that condition is in this bit of the brain or whatever. But in albinism, we don't know. One good thing that people are looking into at the moment is that the retina, which is the clever, sensitive bit at the back of the eye that converts light into brain waves, in albinism doesn't have certain cells which are sensitive to movement. And so people think maybe there's a problem with those cells and therefore they can't sense movement in different directions in a typical way.
Are children born with wiggly eyes?
Not usually, actually. Most people who have albinism and get nystagmus, and in fact people who are born with other genetic reasons to have nystagmus, usually it's only noted at about 3 to 4 to 6 months. Sometimes it can be earlier than that. And to be honest, I have families with children who have nystagmus who, when they have a new baby, they're going to be right on that baby. They're going to be looking at it, and they do tend to report it slightly earlier. But the vast majority absolutely do not have it at birth. And again, this is because the visual system's still learning to see.
So say someone with albinism, I know this is science fiction, but took a tablet and it took away their nystagmus. Would that therefore make their vision okay?
Yeah, so this question's asked quite a lot in lots of different ways. Again, the short answer is no, because the main problem with vision in albinism is actually the development of the retina and possibly some of the nerve stuff behind it, which means there is an absolute limit to how good that eye is going to be, even if it was still. People have done some research before to show that actually if you take someone with nystagmus and falsely hold their eyes still, now we don't literally hold them still with clamps because that's a bit mean, but we can use clever tracking technology so that what they're looking at moves with their eye quicker than their eye can work out. The actual vision doesn't tend to get better. And that actually makes sense because we already know that children's brains need to learn to see. So there's a degree of what we call amblyopia or lazy eye in albinism as well, which is probably in both eyes. So if we held the eyes still for a minute, the vision wouldn't instantly get better. Whether it would if we held them still or completely removed the nystagmus for months on end is a different question. I don't think we know the answer to that. but it absolutely wouldn't cure the whole problem, because most of the problem is this problem with the retina just not being sensitive enough is never going to have that super sharp quality that people expect.
If you're born with nystagmus or you develop it within 3 months or so, does your whole world move?
No, short answer, no. So that phenomenon of noticing the world move we call it oscillopsia. If you're sitting in front of me and your eyes are moving like this and you don't see the world moving, that tells me you've had the nystagmus since a very young age. So children's brains do something clever. Again, we don't understand exactly how, but they suppress that movement so they don't see the world moving. But if you're an adult or an older child and you suddenly get nystagmus for another reason, so you have a brain injury or a neurological condition, you absolutely would see the world moving, and that oscillopsia is a horrible, horrible symptom. So most people with albinism wouldn't notice the world move, but would also say very rarely, when I've been ill, when I've been really tired, that sort of stuff, they might notice the world wiggle. What do you think? Have you noticed that ever?
If I'm really tired or if I'm really poorly, I get moments of it, and it's really disconcerting and it's horrible. And I also get it with certain lights as well. So if I look at LED lights or like red lights you have in like electrical equipment, if it's dark and I stare at that, I'm going crazy because my eyes are just, I can just see everything moving.
Yeah, it's horrible, isn't it? And it makes you realise what it would be like to suddenly get nystagmus when you can't suppress that movement. And what that means actually, from a very practical sort of, again, doctor-y point of view, is that when we have patients who do have oscillopsia, what we're trying to do for them is often very different to what we do for patients with nystagmus without oscillopsia, because it's the sensation of movement that we're really trying to focus everything on. And patients will often want you to do anything you can to try and do something about that. But in albinism, most people are protected from that most of the time.
Does nystagmus contribute to like clarity of vision?
Yeah, it probably does. And it's probably not just clarity. It's probably other things which are a bit more complicated about vision, like speed of seeing. So there's this term used years ago called the slow to see phenomenon in people with nystagmus. And what that means is if you sit in front of a chart where you're reading the letters, you know, those charts you have in opticians or whatever, you're reading black on white, you're given as long as you can to read as low as you can down the chart. So that's a useful measure for lots of things. But when you walk around in the real world, you don't walk around in a monochrome black and white world where you've got as long as you like to try and resolve a little tiny thing. What you have to do is quickly survey your surroundings, find the thing you're looking at, ignore the other stuff, move around, notice moving targets. It's those things which nystagmus tends to have more of an impact on. So it's the complicated bits.
So I guess we're also saying that measuring vision, sitting on a chair in a dark room looking at an eye chart, not only with nystagmus, just generally with albinism, isn't necessarily an accurate reflection of the reality of that person's visual outcome. In that, so for me, you were saying about it taking longer to see things. So if you were to hand me something, I didn't know what it was you were handing me, I might look like I'm disinterested. If you were to hand me a pair of scissors, but I didn't know, you just handed me something and said, "Here, Christina, hey, here's this." I'd look at it for like 3 seconds before I actually knew what it is. My brain, I can't look at it and know straight away what it is.
Yeah, absolutely. And I think that's really typical. That's what people say to us. And it's a very, as you say, it's a very false recording, isn't it? Being in a dark room. So your photophobia is not, what it is in the real world. You're not having to scan the room and find the thing you're looking at because someone's put it right in front of you and said, look at that thing. You're given as long as you like, which you don't get when you try and cross a road or walk down a busy street. The visual acuity thing is a real problem. So there's lots of people working on this, and there's been papers published with the title Beyond Visual Acuity, which kind of says it all really. The visual problems in albinism are beyond visual acuity.
Yeah, it doesn't measure walking in a crowded space where you have to try and weave in and out of people and you're stood there thinking, I don't know where to go because everything's moving too quickly. It doesn't take into account any of the real life situations that actually really affect what you can and you can't see.
Yeah, I completely agree. And just going back to your original question, the nystagmus definitely adds to that. But underlying it in albinism is a fundamental limited resolution of your eye. So if you think of it as a camera phone, the kind of resolution, it's a kind of, iPhone 1 or whatever versus a modern one. It doesn't matter how good you get with the lenses, the chip is just has a limit on it. So all of these things are on a background of the retina not developing fully, and that really is the fundamental problem with absolute vision.
And what are some of the other impacts that nystagmus has? People talk about that it can affect your balance. Again, I'm talking about within the albinism community, and I don't know, people with albinism, hard to know where one part of our eye problem starts and another stops. But people say that they struggle with balance. Is that a thing with nystagmus?
So it can be, definitely. So balance involves a whole load of different things. So it involves balance organs, so little gyroscopes in your ears and your brain, they're really complicated systems. And one of the inputs to that is your eyes. So your eyes are useful for balance. There are also some conditions where you have nystagmus and the balance problem. So nystagmus is related to some of those conditions. In albinism, I do have this reported that people have a problem with balance sometimes, but often it is quite hard to tease it out, to be honest, to know how much of it is visually guided and how much isn't.
And what about, again, this is within the albinism community, people always say and think that they have issues with judging depth. So their depth perception is because of nystagmus. Is that a nystagmus thing?
Again, it's an unsatisfactory answer from me, I'm afraid. It's partial. So depth perception is you do that in two ways with your eyes. The typical one that people know about is that you use two eyes that are in slightly different places to look at the same object. Your brain combines those images and works out that the angle means that thing must be slightly closer or slightly further away, and that's called binocular vision. And when you have binocular vision, or stereopsis is another word people use, that's useful over a short range. That's why people have it tested. When you see the orthoptist, they'll test these things. In albinism, you're less likely to have it for a few reasons. Partly the nystagmus will contribute to you not being able to combine those images brilliantly, partly because having a lazy eye, so having amblyopia, is more common. But also the second way that you experience depth perception, or you perceive depth perception, is by things such as parallax. So when you move around, you can actually have one eye covered. You can move around and your brain will work out, just because of the different images you're getting, that something's closer or further away. But that relies on that eye having really good vision. So just the having lower vision itself will also reduce depth perception to some degree. So it's a kind of mixed bag, but the nystagmus definitely contributes to some degree.
And quite often people with albinism literally can't recognize people's faces. I can have this with my parents or my children. I will walk past every single person in the street and I have no idea who anyone is unless I hear their voice, because I can recognize their voice. Is that related to nystagmus, or is that just a generic albinism thing?
It's a combination of the just lower vision, less ability to resolve things, to see in the detail of things. But nystagmus definitely is contributing to that as well. So I have children with nystagmus who don't have albinism. Every other part of their visual system's fine, their eyes just move, and they report the same thing. And that's partly because when you're trying to recognise something, your brain actually moves your eyes around. You scan around it and build up a picture. Nobody realises that that's what your eyes do, but it is. And so that process is much more difficult when you have nystagmus, when the eyes are moving. The ability to see things, particularly in complicated scenes or moving targets, is definitely harder in nystagmus. But there's probably also an element of absolute visual acuity. And it's actually the nystagmus, interestingly, that when I talk to parents who've got young kids with nystagmus, because of albinism or not, what I often say is, as they get older, you might start to notice things. Doesn't mean that things are getting worse, it's just you're expecting more of them. And often the first thing parents report to me as a kind of thing that they've noticed that their child struggles with visually is recognising faces. And it's often when they pick them up from nursery and they know full well that their child can see them from 10 feet away, but the poor child is looking at 20 parents' faces, so they've got to scan around and find the right one. And it's that bit that's the problem. It's not the fact they can't recognise their mum from 10 feet.
Nystagmus isn't a static condition. So you have nystagmus and then your vision is always going to be the same. Are there things that make nystagmus better and things that make nystagmus worse?
Yeah, so most people with nystagmus will have variation. So the way I describe it to people is you'll have variation during the day. There'll be parts of the same day where your nystagmus is worse or better. You'll have weeks where it's a bit worse. You'll have months where it's a bit better. it absolutely does this on the short-term and longer-term basis, but over a lifetime we expect it to stay relatively in the same ballpark, certainly once you're over the age of 6 or 7. The sorts of things which tend to make it worse, and parents report this all the time, is when their children are upset, when they're being told off, when they're super tired, when they're ill. For people with albinism, if they go out in bright lights, often that brings it on, or as you mentioned, different lighting conditions. Those are the sorts of things that tend to make the nystagmus worse, and the things that make it better are essentially the opposite of those. So calm, darker, sedate situation, and also where they're not really struggling to see something. So struggling to see something often makes nystagmus worse. The other part that often people with albinism and nystagmus have is something called dampening with convergence. What that means is when they look at something near to them, so you're looking at something here, your nystagmus might dampen compared with when you're looking for something across the room. So just literally the difference in distance, because it means your eyes turn in and then nystagmus can dampen a bit.
Is that because people can see better close up than they can far away?
It's a bit more than that. It's because of, we think of the actual converging mechanism for some reason dampens the nystagmus. When we do a near vision test, we can put a letter or whatever, and then we do a distance equivalent one. The one the distance obviously is physically bigger, so it's matched for the distance you're doing it. So if I hold up a chart at the end of the room, we can do an equivalent one here where it's much smaller. So it's not just because it's physically closer, because we've made the thing smaller anyway. There's something extra about because your eyes are turning in that seems to dampen it.
There are various things that people kind of do to try and compensate for their eyes wiggling. You can, correct me, but you can tip your head down or tip your head up or turn it to the left or the right or any combination. Why do people do that?
Most people with nystagmus, particularly the types you're born with, will have a position where they can hold their eyes, as you say, to the side, to the top. It can be anything really, where the nystagmus just dampens a bit. So it gets less big, if you like, sometimes less big, sometimes less frequent. It just dampens. It usually doesn't go away, but it dampens. And that area, we call that the null zone. Again, we don't fully understand why that happens, but often kids will have one and it will become robust in the first few years of life and often stick with them, actually. It can change a bit, but generally stick with them. When that happens, that's something that we can help with surgery on the muscles of the eyes to move that preferred position, or that position where the wiggle is least. We can move it to the middle with surgery. We don't always do it. Sometimes it's useful, sometimes it's not. Generally, the principle is we want kids to use that null zone because by definition their vision is better in some way. We don't want to encourage them out of it. What we actually want to do is get them to use it. So if it's so severe they're not using it because they don't like holding their head upside down or they're falling down the stairs, then that would be a really good reason to get on and try and move that preferred bit to the middle with some surgery.
Can you talk people through what that surgery is, what it involves, what are the benefits, what are the outcomes?
Yeah, absolutely. I mean, you could do a much better job than me because you've had it and I haven't. But I can tell you from my side of the desk. So it's a bit of a misnomer. It's an unfortunate term that we call it head posture surgery, because we have to very quickly say we're not moving your head. We're not doing we're not turning your head backwards or something. This is surgery to correct a head posture, which is what we call it when people like one position of their face looking somewhere other than straight. And what we do is we move muscles on the eyes. So the eyes all have muscles, two that pull it up, some that pull it that way, some that pull it down, and a few others. And essentially what we do is we move those to make them slightly stronger or weaker, so that the brain thinks you're still looking this way, but actually your eyes are sitting straight. We generally do 4 muscles, sometimes just 2 muscles, sometimes more, and we have to work it out and work out which muscles to move depending on whether the head posture is there, wherever it is. That surgery is done with people asleep, obviously, because we're not mean. The eyes are quite sore afterwards. I'm sure you can speak to that better than me. The vision can be a bit odd afterwards. Sometimes it can dampen the nystagmus just because we've irritated the eyes oddly. And most people would have a good result, but there is definitely some guesswork involved still. So quite often we just don't quite do enough, or we very occasionally do a little bit too much. And the important thing about head posture surgery is that we don't think it's a lifetime fix. So lots of patients a few years down the line, unfortunately, the head posture might just return a bit. And so we might go in and do a second surgery. And that's probably what's been going on with you, Christine, I would imagine. I'm sure you can speak to that detail more than I from your side of the bench.
I had head posture surgery last year because I had a head turn, and it's absolutely taken away my head turn. And the reason I had it done was because I'm an old person and I get really bad. My posture is really bad, and I was getting, my neck and back have got loads of problems because I have, for all my life, been holding my head in a strange way. So it sorted that out, but I'm a bit of a weirdo. I don't know how common it is as well. I have a head turn and a head tilt as well. Mm-hmm. So now I've been left with a head tilt, but since I've had my surgery, I think I'm doing more head tilting than I was before. Yeah. So I'm now having surgery to have my head tilt sorted out. Is that common to have more than one place that you see better?
It is, and it's sometimes still one place, but it's in two different planes. So if you turn your head like this and you tilt that way, we have to think about using different muscles to try and fix that. Sometimes it's a two-step process. So often I'll say to parents, look, we're going to fix the bigger bits first. We'll see what you're left with, and then we'll try and fix the second bit. Sometimes we might try and do all of them in one go. Sometimes, to be honest, fixing a head turn might then make the tilt a little bit worse. So you might note, or at least you'll notice the tilt more afterwards because you're not turning anymore. There's lots of variation within it, actually. But it's definitely worth people knowing that it's not once you've had the surgery, you are fixed for life. It's gone at the end, because it's reasonably common, actually, to need something to either update the surgery or correct a final little part of it, or it recurs over a long time period. And I operate generally on little children, so I do see them recur.
Is there a finite amount of times that you can have that surgery?
Technically, you can keep going, but there's definitely a law of diminishing returns. We say your best chance of making the best or having the best effects is with surgery number one. Some people have 2, 3, 4 surgeries. You can even have up to 6 or 7 surgeries. But again, with head posture surgery, once you start going beyond 3, 4, 5, 6, we're generally doing little tweaks because you do start to lose some of the effect of what you're doing. But there's technically not a limit on how many you can have. No.
Can you make vision worse by doing it?
That's really rare. The main thing is we are taking muscles off the outside of the eye. So it's all done on the outside of the eye. We're taking muscles off, changing them, stitching them back. There is always a risk of damaging the eye itself and making vision worse. So that's all should be on people's consent forms. But it is extremely rare, I would say. So that's the main risk that we consent for. In terms of making it worse, and for head posture, that is very, very rare indeed. I don't think I've ever seen that. I don't think that's a big concern people need to worry about in terms of changing the nystagmus or making the head posture worse. But they just need to be aware of this tiny risk of making the actual vision worse. And again, rare.
I know we've talked about albinism and that there's lots of things going on with the eyes. Can it make your vision better? Can you have a better visual outcome after head posture surgery? I mean, that wasn't the case for me, but can that be?
Yeah, that's a hot debate. And there's been debate about this for years. And some people are convinced that the head posture surgery usually makes the vision better, so it gives people an extra line on the acuity chart. We've said already we don't like acuity charts, but I've definitely had some patients where they seem to do a bit better than they did before, but it's a complicated thing. In the UK, we're super conservative, so essentially we consent patients, and the point of the surgery is to correct the head posture and put that null zone in the middle. There's some evidence that we might widen that null zone. So if there's a range in which your nystagmus is least, and it's this big when you look this way, it might get a bit bigger, which is going to be a useful thing when you put it in the middle. And for some patients, the vision does seem to get a bit better on an acuity chart. And probably, again, we're missing a trick here because we're probably not measuring the important thing, which is how intense that nystagmus is, or how the time to see for a patient. So are they seeing things quicker since we've moved it? Because there are a lot of patients who report a lot of benefit from head posture surgery, kind of beyond just moving their head.
Does head posture surgery, I can't answer this because I've no idea that my eyes move, but does it make the wiggle less?
So it can a bit. It certainly will look like that because your preferred null zone is where your eye wiggles the least. And if you put that in the middle, you're going to see that less, right? Because it's just in the middle. Straight after the surgery, often it is quite a bit less, as I said. Well, I say a lot. Sometimes it's less, but that's because of some odd sensory feedback thing that we've known about for years, where if you irritate the front of the eye with someone with nystagmus, often it dampens, interestingly, but it doesn't tend to last super long. And there are some patients who think that the nystagmus overall is just far less intense after surgery, so it tends to be a variable thing.
What other treatment options, aside from head posture surgery, are available? So I tried gabapentin before I had my head posture surgery, and for me it didn't
it didn't do anything? What treatments can people have?
It's generally surgery, medications, or contact lenses. Sometimes people try, and there's some people done some good studies on this. There's some evidence that some people contact lenses can do that thing I was mentioning a minute ago, where essentially we think it irritates the front of the eye very slightly, and there's some sorts of sensory feedback which reduces the nystagmus. And again, I've had patients who go into contact lenses and are absolutely convinced their nystagmus is better. And I have a few where it definitely makes the vision better. But the hard thing about that is that contact lenses are often optically much better than glasses anyway. So it's hard to know whether it's dampening the nystagmus or it's just a better optical correction. And then the final thing is medications, as you mentioned. So there are quite a few that people use for nystagmus in other situations. So gabapentin, memantine, some aminopyridines. There's all sorts of fancy drugs generally given by neurologists, a lot of which actually aren't available in the UK. But again, most of these drugs have side effect profiles, which definitely need to be looked into. And my practice is mainly children. I don't tend to dish them out very often, if at all. Pregabalin we have used a few times, but again, there's usually a significant side effect profile. And unfortunately, these aren't clever drugs for nystagmus. They're not going into your tummy and then going to your cells that make the nystagmus, because we don't even know which cells they are. I think most patients with nystagmus who are trying lots of different medications would be those ones that we've talked about before, which might be adults who have what we call acquired nystagmus, where they haven't been born with it. And so they are absolutely maddened by this sensation of the world moving, and they are desperate to try anything to stop that. When that isn't the case, such as in albinism for most people, we don't tend to use drugs very often at all.
Currently, there's no treatment, there's no cure for nystagmus.
No, there isn't, unfortunately. There's treatments for the things which are caused by the nystagmus, so head posture, possibly even refractive error if you consider some of that contributed by the nystagmus, but we don't really have a good treatment to take it away. There are some things which might just dampen it and might reduce some symptoms in some people, but most of those are not really for the albinism community.
Thank you so much for tuning into that episode of Albinism Life with me and Jay. It was a really interesting conversation that we had, learning all about nystagmus and the impact that it has on people with albinism. If you want to get in touch with me, please email info@albinism.org.uk, and I'll see you soon. Bye.